So we're joined by Caroline Bolling, and she's just going to start off by giving us a quick origin story as how she got to here now.
Well, thanks. So I'm originally from Brazil. I'm a sports physio from Brazil. I lived there until 2014, and I used to work in a sports club there, a big sports club called Minas Tennis Club. And it's not just about tennis, so we had like about 1,000 athletes, and I think I was an intern there, and I worked with many Olympic athletes. That's kind of also a beauty of working with youth sports. So the young athletes become Olympic athletes later on. So I still see athletes that I saw back there that they were in Tokyo. So it's also something really cool to see that, I'm not there, but they still there. So it's also you still see your work. And I also work in public health with a public health center in Brazil with poor communities. So it was also sometimes trying to bridge those two things. And in 2014, I ran away with Circus, and I became head therapist in Cirque du Soleil. Did some European tour, South Asia, and Australia and New Zealand. And then after that, I moved to the Netherlands to do a PhD that was mostly only qualitative methods, trying to understand how people do injury prevention in performance-driven environments. Yeah, that's it.
So just as we touched on there, your research focus is now qualitative research. So my dissertation is around mental health and well-being and involves a lot of qualitative research, and I quite like this sort of research because it helps us understand why, so not just the numbers that you get with quantitative. But there's some sort of issues around people not thinking it's as good as quantitative research, and you can't get as much out of it, especially when you come to like statistical analysis of it. You can't really put a number on anxiety, for example. So what are your thoughts on these issues, and how can we bridge the gap between quantitative and qualitative data?
Well, I think it's not such a... I think we have this idea that quantitative, it's really objective. I like to cite this paper that they gave a data set to 11 different statisticians, and you came up with 7 different ways to treat that data. So you can understand that it's purely quantitative, but still people will have a different way to solve that. So in one point, but in the same way, it's also the lack of being systematic. And I think that's also a problem that sometimes people don't understand, that qualitative research can be systematic. And of course, there is different approaches, but me and as an author, but nowadays I review many papers, the main difficulty that I see sometimes is like, you need to tell me exactly what you did. So be systematic when you tell me about your methods. And then the main thing about any research, it's the research question. And there is no quantitative being better than qualitative or the other way around. There is some research question. So if you ask me how many, I would not be willing to interview people and say, how many times did you got injured? It doesn't make sense. I can use a survey, or I can have a really good reporting system. But if I want to know, how do you feel when you get injured? Why do you do this? Or why do you look for a physio? Then it's a research question that needs a different method. And what I feel mostly with injury prevention, what happened is, for many years, we've been saying, oh, we are able to prevent injury. And then after that, we say, but athletes are not doing, or coaches are not doing, or people modify. And we didn't dare to change methods and start to question why people are not doing. Or they do something, how do they do? So it's kind of mostly back to basic research methods, that everything starts with a research question. And there is not better or worse. It's just good science or bad science. And there is both for quantitative and qualitative.
Yeah, I think you put that really nicely, where it's not about which one's better, it's about which is suited to the question that you're asking and to the answer that you're trying to find. So yeah, I think that's a really good way of putting it to people that might have the belief that one is maybe better over the other. And then just coming back to the presentation that you gave earlier about the complexity of acute injury. I thought it was really interesting and really eye-opening to hear how there's so many more factors to an injury that as physios we might treat as being very simple in cause and effect, like you described. Could you just give a quick summary of that, of your talk and everything that you spoke about?
Well, for me, when we talk about complexity, and we could go to many ways to talk about complexity, but one of them, it's exactly, for instance, the need of more than one approach. So, for instance, if we deal with a complex problem, you probably will need quantitative and qualitative, and they need to complement. So it's one of the things. So in my talk today, what I try to say, and the main message, is that we need to look to the complexity of any sports injury, to be honest. And of course, the focus today was in acute injuries, and I gave the example of the simple ankle sprain. I had this really nice story with a master's student that she had to present her clinical reasoning of a case, and we asked to be a complex case. And she presented a case that was an acute patient with a knee sprain or something. And I said, oh, you are the one. And she didn't pass. So she came to me and said, hey, what's the problem? And I said, oh, you were the one that had that acute patient and all. And she said, yes, but it's a problem that was an acute patient. It's because my patient was not complex enough. And I said, no, the problem is your approach was not complex enough. So if you don't explore what's going on around your patient, every ankle sprain will be simple, and even a low back pain with many years of symptoms can also be simple, because it depends on how you approach that. So what I try to think, and I must say that being a researcher also changed the way that I am as a clinician. Right now I'm more open to the things that I don't see it, and I invite more the patient to kind of contribute and let them tell me what I probably not seeing, or what it's other things that are influencing your symptom, or how that injury happened. If there is any way that we can prevent, because then it's also something that I think we always have to think about. Like, as soon as is an acute patient, I don't want you to come back. Every chronic patient once probably was already an acute patient, and maybe the approach was not sufficient. So I think that's also something that we need to think about. So the main message is we need to explore complexity, and to do so we need different perspectives. And usually the easy one would be the patient, but can also be the coach, can also be the other stakeholders, sometimes a manager of the team. Or so it's also like just broaden up the idea of stakeholders. It's anyone that in some way are influencing factors, and remember the interactions. So it's not that because I cannot do anything with your contract that I say, okay, I don't care about that. Well, maybe I can understand what's going on, and how does the time of recovery of this injury will in some way limit your chance for a new contract, and then we can use that more like as something that we think about all the interactions. And to be honest, in the recovery time, or maybe in the speed of my rehab, it's something that I can change. So I cannot change the contract, but I can change that. So it's a little bit thinking of what's my power of influencing also some factors that by the end will interact with something else.
That's really interesting. So one of the things you spoke about in your presentation was how you've discovered so many more factors in more recent years that build into this complex and this complexity approach. Do you think that we've got an exhaustive list now, or do you think there's still going to be so many more that we find, so many more things that we understand better, and just it's going to just keep growing and keep? Because some of the diagrams you had on that this display were all over the place already. I'm not sure they can take much more. But yeah, do you think we'll continue to adding to the complexity?
Well, one of the things about complexity is because it's time dependable. So the map, the obesity map from Foresight, that's relatively old right now. And probably if you look back, you're going to realize that there is some things there that doesn't exist anymore, or there is new interaction. So when we are able to map a system, we map the system as it is right now. And it's the same thing with patient. The patient that we see right now, and we try to map and understand that, it's the patient today. But you know that new patterns will emerge, and then you have new interactions. So what I feel, it's like, of course, components will be important, but when we talk about complexity, we also need to think about how the system behave. And we cannot predict, but we can look for a little bit of the hubs or the main things that are making changes in that system and try to change that. So for instance, culture, I think it's a big one that we don't realize. One thing that I realize now when I do interviews, it's, for instance, the difference on generation. I never interview an athlete that it's, let's say, 20-ish that mention, I never heard about injury prevention. But I do interview athletes that are 30 plus that say, as a young athlete, I never heard about, and nobody even care about that. So it's also, so if I would do a map, so it might be completely different if I would do 10 years ago or now, and probably what I would do. So it's also not just about mapping everything, but trying to find how the system changed and how the system behave and how those components interact. And I think it will be like a constant thing. We couldn't imagine that Instagram would be something that people use for rehab and getting science and getting still updated. But to be honest, nowadays it's a big tool. So it's just like we just need to think that sometimes things change and we need to adapt, and then new patterns will emerge, and we need to learn with that. So I think it's dynamic, and we'll be still not growing but changing.
Thank you very much for that, and thank you very much for your time and speaking to us today.
Thank you.